Good evening, everyone. Thanks for joining us for our Eating Disorder Hope Google Hangout. We're so glad you could be with us tonight and hope everyone had a great holiday. We are so honored and thrilled to have for our special guest this evening, Dr. Scott Moseman, who is the medical director at the Laureate Eating Disorder Program. And we are going to be talking tonight about neurobiology and how it's connected to eating disorders, which is definitely a growing topic and very important in this field. So welcome, Dr. Moseman. We appreciate you being here with us tonight, and thank you for your time.
Great. Thank you so much for having me.
So just to get started, can you maybe just tell us a little bit about yourself and your background and kind of what's gotten you to this point as medical director and what you're doing now?
I am a child-adolescent psychiatrist. I was actually born overseas, but I grew up in Texas and Oklahoma, trained in Texas and Arizona and Pittsburg before getting my child-adolescent psychiatry fellowship. And then I moved back to Tulsa 11 years ago, and I've been involved with the adolescents, outpatient, and then most recently as medical director at Laureate since that time. And I've been involved in the Laureate Institute for Brain Research, where we do neurobiology research since its inception about 6 years ago.
Wonderful. Thank you so much for sharing that. And what is kind of what has inspired you to continue working in the field of eating disorders? It's definitely a more challenging field, I think, and very complex. So can you maybe share with us what has inspired you to stay in this field?
Absolutely. So I have, been in and out of working in eating disorders both through my adult psychiatry residency as well as my child fellowship. I've also worked with mood disorders. I work with severe anxiety disorders as well. So sort of prefer those sort of more complicated illnesses. And in the field nowadays, with the way psychiatry is, at least in inpatient and residential eating disorders treatment, I really get to work for extended periods of time with families and really take them along, take a patient from being very sick to really functioning well again. And in the world of psychiatry, being a psychiatrist, sometimes we're not always able to see that. A lot of it is crisis-driven, and the ability to really treat somebody over a longer period of time and see them well is something that's really rewarding. So I've been at Laureate for 11 years now, so a lot of baby pictures and a lot of people graduating college and graduate school, and getting to hear about those things is super rewarding.
Absolutely. That's amazing. Thank you for sharing that. So we're going to jump right into our topic about neurobiology and how it relates to eating disorders. And I think this is such a fascinating field, and the more research that's coming out really breaks a lot of the stigmas about eating disorders. It's commonly misunderstood that if you have an eating disorder, it's like a disease of vanity, but the reality is there's many more factors behind it, and one is neurobiology and seeing that that can really influence a person's susceptibility to having this disorder. Can you share a little bit about your understanding about the connection of neurobiology and eating disorders?
Yeah, so in the world of neurological and neurobiological science, eating disorders is pretty late to the field. So I was in medical school in the mid-90s, and when we were learning about psychiatry, psychiatry had moved out of the world of, of Freud and of everything being related to your environment and your experience. The 90s was a decade of the brain, so that there was new studies coming out to show that schizophrenia and major depressive disorder were all related to biologic-based and genetic-based changes in the brain. However, when I was studying in the mid-90s, anorexia nervosa specifically was still seen as an illness that was caused by over-involved mothers and distant fathers, that it was a disease of control, a disease of choice. And so really, only in the last 30 years has the field sort of come in where Tom Insel at National Institute of Mental Health has called this a genetic and biologic illness. Certainly recent treatments like Maudsley or family behavioral therapy has used neurobiology as a central tenet to try to take blame away from families, since as a field we actually installed families with a lot of blame over time. So it's a really important difference, and can be really important for patients as well, that they don't feel like they made some wrong choice, or a lot of my patients have self-esteem issues. So when they understand that there's wiring and things that they have, and there's ways to work around that wiring, it can give them a sort of a lot of hope that things can be different. And for the field, it's important. As a child psychiatrist, I'm using medications and things to change the brain, and unless we have some idea about exactly individually how neurochemistry gets off, then it's hard to make informed choices about treatment.
That's very interesting and very fascinating. And you said that you've been involved in the research for about 6 years now at Laureate?
Yeah, I mean, Laureate's been around for 25 years, and for the last probably 15 to 20 years, there's been some sort of research. Now, the Warren Foundation has set up the Laureate Institute of Brain Research over the last 6 years. We have 2 fMRI scanners, 8 full-time investigators, 3 of which specifically work in looking at eating disorders, but we have others that look at depression and PTSD, substance abuse, and other kinds of things. So, working in the field as the medical director, my main job is to work with the primary investigators to talk about what studies seem relevant for the field. We're going to get a patient in a study. Let's do a study that's not going to traumatize them, that's going to be safe for them, and that's going to give us information that will really aid the field in moving forward. So I've done that for the last 5 years. I work with Dr. Simmons and Dr. Kalsa and Dr. Feinstein, who all do studies related to different areas of eating disorders.
That's really exciting. Can you maybe share a little bit with us about some of that research that's coming out? What are they discovering and finding out about neurobiology and how that impacts an individual with an eating disorder?
So, the hard thing at this point is in eating disorders, when you consider, we're probably entering, 15 years or so of really 20 years of really hard neurobiologic data, getting that translated out from what's happening to the brain to what makes changes from a therapist or doctor standpoint has been a little more difficult. Dr. Walter Kay out of UC San Diego and some others have talked about reward circuitry, understanding the very different reward circuitry that happens in bulimia and anorexia, understanding how a brain is going to react can certainly affect treatments. Probably the most important thing that's happening in the field, and this is for psychiatry in general, is something called research domain criteria. So nowadays, if you're going to get a study done and you're going to get it published or get it funded, they're moving away from talking about the brain as having specific illnesses, so for just depression or bipolar disorder, or anorexia or bulimia, and they're really looking at systems in the brain. So reward systems, or looking at motivational systems, social cognitive systems, and trying to look at things so that mental illnesses, instead of just being a collection of symptoms, are really disorders of neural circuits. And so when you're doing studies, you sort of have to speak the same language. And the hope would be, as a physician, when I see a patient, the biologic data I get is pretty limited. A few labs, I'll get some genetic data, might get some data on how the liver works or processes medicines, but compared to my other physician colleagues, how much biologic data I get about how the brain works is limited. And I don't think we're really going to make advancements in the field until we can individualize and understand neurobiology. If I'm going to be using powerful chemicals to change brain chemistry, if I'm doing psychopharmacology, it's going to make some sense to get signals back from the brain to see how it works. And I think these signals will be important to look at therapy as well. So I think if you're getting specific signals from specific brains, you might understand that something like ACT or CBT or DBT might work better with certain neurobiology or less for others. So I think it'll allow us to tailor treatments that are going to be individually and biologically based.
Thank you so much for explaining that. And are the research that's going on now, is it targeted at specific disorders like anorexia, bulimia, or binge eating, or is it more broader right now?
Well, so it's a good question. So there is, I think the issues are, so we're doing a study actually right now called the T1000, the Tulsa 1000, where we're taking patients, because in studies a lot of times you treat patients with one individual mental illness, and if they have comorbid conditions, you can't even include them. So doing studies in which you look at people and you sort of individualize certain behaviors, so that the question of full-blown binge eating disorder as opposed to occasional binge eating, as opposed to overeating, to look at people who actually binge and purge as part of their bulimia, or ones that have subjective binges and purging or have purging disorder, anorexics who certainly maintain extremely low caloric levels, and maintain low BMIs, to those that have less severe courses of illness. So that I think it's trying to sort of break down the walls and look at symptoms and look at neural circuits in a way in which treatment can be more individualized, so that you sort of can't fit things in a box, that
Right.
it's much more individualized for how the individual circuits are working.
Absolutely. And you touched on this a little bit, but what impact do you think the study of neurobiology is having on eating disorder recovery, and ultimately, hopefully, will have, or what do you hope to see that it will have in the near future?
So, there's two types of research. There's sort of basic science research, so trying to understand neurobiologically how the brains of those that get stricken with eating disorders operate differently is extremely important. So to understand to understand the differences between different eating disorders and what treatments might affect them. And then at the same time, I don't think you always have to build only on basic science. Several people in our labs are really looking at translational research, so research which really might have some ability to make changes more quickly. Dr. Feinstein, or Justin Feinstein, in our lab came from the California Institute of Technology, and he actually does floating or float research. This is where that it's sort of sensory deprivation, but floating sort of adds an element in which you sort of disconnect the body and the mind. A lot of anxiety has to do with ties between a part of the brain called the insula and how it interacts with the rest of the body and how it misinterprets body signals. And so this sort of Control-Alt-Deletes, or separates out those things and can create relaxation and anxiety relief. And even the question, we're going to be running a pilot study in people recovered from anorexia that still have body image issues, about how does body image happen, or how does disordered body image happen, and what happens when you sort of lose the connection and lose your body when you're floating, to try to understand again the elements and things differently, and try to see if it could be something that's therapeutic for patients, whether in different levels of care and different phases of care as well. So you sort of have basic biology research to understand the differences and some basic building blocks, which then can lead to translational research, which can allow you to do things that might actually make differences in outcomes, or differences in how you would do therapy on a daily basis.
And so with this research field being fairly new, how soon are researchers able to translate findings into treatment improvements and options for patients? And it's interesting that with Laureate, it's a treatment program, but you're doing research as well. So are these research findings able to help improve treatment options rather quickly for your patients?
At Laureate right now, so Laureate is an interesting institution. So we are a non-for-profit hospital, and we're owned by the Warren Foundation, who is the foundation that actually owns the Brain Institute. And they actually sit on the bottom 2 floors, and we actually sit above them as a treatment program. And so that is certainly very different from what happens out there, even with academic institutions. So we have some ability to involve patients, both inpatient and outpatient, in our research. I think, truthfully, neurobiology is certainly moving by leaps and bounds, and especially with imaging research, fMRI, et cetera, the ability for computer technology to understand and translate data at a quicker rate has accelerated it much more quickly than I would have anticipated. My guess is we're in the 5 to 10 year range before there is very specific ways in which you can say this study created this treatment which was not available. One good example that's actually not eating disorder related, but certainly related for people with eating disorders, which is trauma research, is that our MRI physicist, Yeji Bedurkin, at the Brain Institute is doing a project where, I think a lot of therapists and people know about biofeedback, but actually doing a project of neurobiofeedback, where the technology is so good now that you can take a patient with hyperarousal and PTSD, put them in the scanner, and give them a signal of how their amygdala, which is a part of the brain which is involved in emotional reactivity that's overactive in PTSD, and give them sort of real feedback instead of controlling their heart rate, actually controlling their amygdala activation over time. And so, a real-time neurofeedback of being able to look at circuitry and loops. So I would still put it at 5 to 10 years, but, again, treatments which are really sort of centered, and individualized to the patient.
That's incredible. Thank you for sharing that. And the treatment, the research that you have ongoing right now, is this something that is just for internal patients, or if individuals are struggling with eating disorders and interested in participating, is this something that's open to the public, or how can people find out more about this research?
It's a good question. I mean, you've got to get to Tulsa, Oklahoma, but we actually, we have at this point, we have the flotation study that's going on, which needs, and also for those people in the area that might be close or otherwise, we're looking for normal control patients that do not have eating disorders, as well as patients with eating disorders. We have studies going on for our inpatients where we're looking at microbiomes, as well as looking at changes in brain chemistry as they're weight restored and refed. Dr. Khalsa is doing some studies with both inpatients and outpatients looking at anxiety and insulin and heart rate changes in anorexic patients. And then the Tulsa 1000 study is a study for people both with any type of eating-related illnesses can enter in the study, and they're sort of creating sort of like a psychiatric EKG. In other words, this is like a psychiatric study to look at how different, psychological or psychiatric changes might cause related brain changes, but you don't, sometimes the problem with studies is you have to have a very specific set of symptoms and a lot of exclusion criteria, but it allows people, especially if you're regional or in the area, to, participate in that study and contribute to the science as well.
Wonderful, thank you. And you did kind of touch on this a little bit, but how do you see the research that's coming out on neurobiology and eating disorders really changing the field? And you talked a little bit about how it's taken a lot of the blame off of families. What other stigmas do you see this breaking or just changing the understanding of eating disorders in general?
The understanding, I mean, for the general public, the other hard thing is that it's still, when I lecture to family practitioners or I lecture to people that are outside the small and very close circle of those that treat eating disorder patients, I mean, we all know each other well and know each other by first name, etc. But when you're talking outside the field, again, the simple idea that this is a brain-based illness that's genetic and biologic, that runs in families and that requires at some point biologic treatment. Again, therapy is a very potent changer of neurobiology. It's just important. I think it reduces blame and stigma. And it addresses the problem directly where it is, which is, sometimes I think the field gets too glamorized with the idea of body image and what's represented on TV and media, just because that's become so important, where those that really struggle with this, what can be severe and life-threatening mental illness, really need tailored treatments that's really going to help them where they're at. And anybody that works in the field also understands that not all eating disorders look the same. And so the only way that you're going to tailor treatment is if you can tailor it specifically to the person's brain that they sort of bring in your office.
Right. Thank you for sharing that. I think that's really important to hear. And just from your own experience as a physician in this field, and the work that you've been able to do these past few years, what encouragement might you share with someone who, even someone who's watching this today who may be struggling with an eating disorder and just unsure about where to get help, how to get help? What encouragement might you offer to this person today?
So, I think there's a couple pieces. in working in the field of the last 15 years, I can without a doubt say that even in that short period of time, the types of treatments, the type of interventions, how we work with families, the types of medications we have for comorbid illness, the types of therapies and effectiveness of therapies just continue to get better. If you look at studies from Strober in the 80s to outcome studies that we're looking at now, that we're seeing that there is better and improved treatment, and people are getting better. I always like to use the number, 90% of people will substantially recover from their eating disorder enough where it won't affect their lives. I think the other important notion to tell patients, especially ones that have struggled for longer periods of time, is to remember, it's a neurobiology thing too, that our brain doesn't get done developing until we're in our late 20s or even our early 30s. And that prefrontal lobe of the brain is the part that can sort of turn down the volume of the anxiety and stress and other neurobiologic abnormalities that happen when you have anorexia and bulimia. So if you've struggled and you're getting into your mid and late 20s, you have never had a brain that's better capable of getting well and of turning down the volume on your anxious thoughts than you do when your brain matures and gets into your mid to late 20s. So it's not a matter of I've had it so long that it's too late. It's actually you've never had a brain that's more capable of getting you well.
Wow, that's really encouraging, I think, to hear. And also, as you were saying about the improved methods for treating eating disorders, can you maybe just touch briefly on how you think this is improving prognosis for someone who has an eating disorder, especially for someone who might just be struggling with reoccurring relapses, but to really address the heart of this disorder? How do you think that's improving long-term care for these individuals?
Well, I think the understanding of how the illness works, I think interventions like family behavioral therapy, interventions like new therapies like ACT and the use of DBT and others to help eating disorders have shown us that we can sort of really tailor treatments to where people are at. FBT has also showed us the importance of how important a nourished brain is for long-term recovery. And again, a nourished brain doesn't always equal body weight either. So a lot of people who have bulimic and other symptoms can still have substantially malnourished brains, and taking in consistent nutrition and getting a brain that's nourished allows it to work. As well as, I fully believe that most eating disorders are stress or anxiety-based disorders as well. So, and they often come along with depression, anxiety, and other things. And as medications and therapies are better tailored to sort of treat the entire brain and all the other symptoms that might push on that eating disorder, I think it gives more hope of therapies with less side effects that can get people well and keep people well as just the support and things that people have. I mean, things like, Eating Disorder Hope and Google Hangout and, for, the National Eating Disorder Association and, Proud to Be Me, there's lots more environments where people can sort of talk and find and get really well-informed help instead of having to keep it secret.
Absolutely. It's great encouragement. Thank you for sharing. And just to kind of conclude our time together this evening, can you just share a little bit about where we might be able to learn more about yourself and the work that you're doing, as well as the Laureate Eating Disorders Program, or the research that's going on through Laureate as well?
Yeah, I mean, certainly, we're part of the St. Francis Health System, so if you Google in Laureate Eating Disorder Program, or if you were to Google in the Laureate Institute for Brain Research, you would see sort of links to both the program, inpatient, outpatient, partial residential, transitional living that we have as a non-for-profit place, a sort of smaller eating disorder program, as well as links to the Brain Institute and all the investigators that are working in the specific studies that you could possibly participate in as well.
Great. And in terms of the new research that's coming out, is that published via Laureate as well?
Yes. So if you go on, there's a couple of things. If you go on the website for the Laureate Institute for Brain Research, there is some links to the papers being sent. My lovely marketing person, Heather, probably about once or twice a year, we send out an email with, we publish somewhere usually in the neighborhood of probably 6 to 8 papers a year, and so, we are, putting those out through emails and otherwise, just to inform people of what's going on and to try to keep at least current with the research that we're doing.
Sure, great. Well, thank you so much, Dr. Moseman. We just really appreciate your perspective and just the invaluable work that you're contributing to the eating disorder community is so deeply appreciated. So thank you for taking the time to be here with us and share all of this great information. And we'll definitely be interested to see the future research that comes through Laureate.
Great. Thank you so much for having me. I very much appreciate it.
Thank you, Dr. Moseman, and thank you to everyone who was able to watch and join us this evening. And we hope that you will join us for our future Google Hangouts and Twitter chats, and you can find out more information at eatingdisorderhope.com. Have a great night, everyone, and thank you so much again. Bye-bye.
Great. Thanks.